Right, the Health Minister, Dr. Joe Phaahla, is calling for responsible behaviour and stronger compliance with COVID-19 protocols during this festive season. This as the country retains adjusted level 1 lockdown restrictions. He says, according to scientific studies, the Omicron variant is spreading quicker than in previous waves, but the rates of hospitalizations and deaths remained relatively low. Our reporter Heidi Giokos joins us now live to tell us more. Heidi, the minister very clear, the Omicron variant almost ruined our December, but it's not as bad as we thought.
Yes, and I think the message, which I think was quite funny, was jab before you jive. So I can jive this December because I've been jabbed even though I don't jive. But that is the message that Health Minister Dr. Joe Phaahla is sending to South Africans, that you should definitely get vaccinated. And the reason this message is being pushed by the Departments of Health and Government is because it is proven that over 70% of those that are currently hospitalized are not vaccinated, and over 40% of those that are hospitalized are only have one vaccine dose. And this proves that there is a possibility that if you're not vaccinated, you could possibly have severe COVID-19 complications. And this is what they are seeing in hospitals. It's a very different picture, Masego, a completely different trend to what we saw in the second and the third wave, where there was a high mortality rate, high hospitalization admissions. In one day, we used to have over 800 hospital admissions, whereas now it's remaining just under 600. Sometimes it's over 600, but it's a lot less compared to what we saw in the third wave, which was the Delta wave. And this is, of course, not putting as much strain on the hospital facilities. But let's listen further to what the Health Minister had to say about jabbing and jiving.
Over the last 7 days, we have seen a 70% rise in hospital admissions, though in absolute numbers, as I've mentioned, it's a high percentage because we come from a low base. But in terms of absolute numbers, we're still at a fairly low level, just over 7,600 patients admitted as a result of COVID. Now, in comparison of the fourth wave, when you compare with the previous waves, the weekly average hospital admissions are definitely much lower than the weekly admissions in the third wave. And as we will see, during the first 2 weeks, when we compare the first 2 weeks of the fourth wave and the third wave.
All right, Heidi, tell us a little bit more about this hospitalization rate.
Yes, so I think it's crucial for us to understand what exactly is going on in our hospitals regarding the Omicron variants. During the second and third wave, we had high hospitalization rates and we had people needing oxygen and being placed on ventilators very early in their hospital admissions. This time around, we're not seeing that, according to the NICD. What we are seeing is that when people are hospitalized, it's a very mild case and it's not as severe. What's also important is that about 2 weeks ago, Masego, we had that health briefing where the NICD came out and said that over 11% of those under the age of 5 are being hospitalized. And this was a worrying trend. We asked the question, why are they being hospitalized? We were told it's because they're more susceptible and they have not been vaccinated. During the third wave, it was only 5% of those under the age of 19 and under the age of 5 that were being hospitalized due to COVID-19. During the fourth wave, the Omicron variant, it's over 20%. It's not as concerning as we all think at this stage. The NICD saying that they are monitoring the situation and there has been nothing severe yet. There's also been no death linked to Omicron, especially in the younger population, which is, of course, something that we were all very worried about. But hospitalization, very not as severe as what we saw in second and third wave, and it's not as high. So previously, we'd see almost 1,000 hospital admissions a day, and now it's a lot less. And the important part is that it's not as severe. So you'll be hospitalized for 2 or 3 days, and you'll be out of hospital, and you wouldn't have needed oxygen or ventilators in most cases. But let's listen to Dr. Michelle Groom on that.
We've seen this rapid increase in the case numbers, but then the hospitalizations are not increasing as at such a dramatic rate, and we're really seeing very small increases in terms of the number of deaths. And this is really just the excess deaths from Gauteng, where with previous weeks, we've always seen this peak in the excess deaths, very much mirroring the peak in cases. And you can see very low numbers in terms of excess deaths in Gauteng for last week.
All right, and the eNCC meeting on Monday or Tuesday, Heidi, you know, every time we talk about this, I imagine South Africans just cringing.
Literally, and that's why I keep saying jab so you can jive, because this is the message from the Department of Health. But very important to highlight the fact that the National Coronavirus Command Council will be meeting either on Monday or Tuesday. The Health Minister, Dr. Joe Phaahla, saying that it's basically on South Africans. It's our responsibility to act responsibly and make sure we adhere to the COVID-19 regulations, and also just to possibly be in ventilated spaces. So outdoors, wear your mask. If you haven't been vaccinated, get vaccinated. This is the message from government, and hopefully we won't have a situation this December where we are in stricter lockdown. But according to the stats, Masego, it's going to be very difficult for government to try and argue why there should be a more harsher lockdown because of what our hospitalizations look like and our death rates. If things change drastically in the next week or so, then of course it's a conversation that the eNCC will have to have about the strain it's putting on our hospital facilities. But in terms of exposure, we know that Omicron's highly transmissible, but it's about how sick an individual actually gets, and that's why they're urging for people to be vaccinated. But we'll just have to wait and see if they stick to the jab and jive. I keep saying it because even the way the minister said it, it was very, he was so passionate about it, because he said, you know, South Africans have been through the most in the last almost 2 years with this pandemic, and hopefully this time around we'll have an easier Christmas.